Abreva Cream, also known as Docosanol, is used to treat cold sores and fever blisters, also known as herpes labialis. It can help speed up the healing process of the sores and reduce symptoms such as tingling, pain, burning, and itching. This medication works by blocking the virus that causes cold sores from entering healthy skin cells and multiplying. It's important to note that Abreva Cream does not cure herpes and does not prevent passing the infection to someone else. It also does not prevent future occurrences. It's important to avoid using this medication to treat canker sores, shingles, or genital herpes. When using Abreva Cream, it's important to follow the directions on the product package or as directed by your doctor. Apply the medication at the first signs of a cold sore, such as tingling, burning, redness, or a bump. Make sure to wash and dry your hands before applying the medication, and clean and dry the affected areas. Apply a thin layer of medication to cover the cold sore area or the area of tingling/itching/redness/swelling, and rub in gently. This should be done 5 times a day every 3 to 4 hours, or as directed by your doctor. Remember to wash your hands with soap and water after applying. Do not apply the medication in or near the eyes, mouth, or nose. If you accidentally get medication in your eyes, flush with plenty of water. Also, remove any cosmetics from the affected area before applying the medication, and use a separate applicator for infected areas to prevent spreading the infection. The dosage of Abreva Cream is based on your medical condition, type of infection, and response to treatment. It's important not to use this drug more often or for longer than directed. Use it regularly at evenly spaced intervals to get the most benefit from it. Keep in mind that Abreva Cream does not prevent the spread of herpes, so avoid close physical contact with others during an outbreak. Also, try not to touch the cold sore and wash your hands if you do touch it. If your cold sores get worse or last for more than 10 days, stop using the medication and consult your doctor. If you experience redness or swelling, it's important to consult your doctor or pharmacist. In rare cases, a serious allergic reaction may occur, so seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember that your doctor has weighed the benefits of this medication against the potential risks. Many people using this medication do not experience serious side effects. It's important to contact your doctor or pharmacist if you notice any other effects not listed here. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Abreva Cream, make sure to inform your doctor or pharmacist if you have any allergies. This cream may contain inactive ingredients that could cause allergic reactions or other issues. If you are pregnant, only use this medication if it is clearly needed. Discuss the risks and benefits with your doctor before using Abreva Cream. It is not known if this drug passes into breast milk, so consult your doctor before using Abreva Cream if you are breastfeeding. When using Abreva Cream, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. To minimize these risks, it's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Abreva Cream. If someone accidentally swallows Abreva Cream, it can be harmful. If the person shows serious symptoms like passing out or having trouble breathing, it's important to call 911 immediately. Otherwise, contacting a poison control center is necessary. In the US, residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share Abreva Cream with others, as doing so may spread the infection. Cold sore outbreaks can be caused by various factors including stress, hormonal changes, injury or surgery on the mouth, tiredness, sunlight, cold weather, or fever/cold/flu. Abreva Cream is specifically designed to help alleviate the symptoms of cold sores and speed up the healing process. It is recommended to apply the cream to the affected area 5 times a day until the cold sore is healed. The best time to apply the cream is at the first sign of a cold sore, such as tingling or itching. If you forget to use Abreva Cream at the scheduled time, use it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed dose and continue with your regular dosing schedule. Do not apply double the amount of cream to make up for the missed dose. Make sure to store Abreva Cream at room temperature and protect it from freezing. If you have any questions about how to store it, you can ask your pharmacist. And remember to keep all medications away from children and pets. When you no longer need Abreva Cream or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.